The trends are heading in the right direction. The number of new cases continue to decline. I've said many times at this podium, any reopening of our economy will be gradual, measured, and safe. As we watch the trends carefully every day, as we see the number of new cases inch downward, we've been preparing to get more and more of our economy working again safely and cautiously. Because when it comes to reopening our economy, I'd rather be safe than sorry. We've been working around the clock to make sure we're ready. We're using this time to help businesses adapt to the new environment we face. That's why over the past few weeks, we've laid the groundwork for the gradual and safe reopening. We released a framework with clear public health criteria to meet before proceeding to each stage of reopening. Working in partnership with our health and safety associations, we've released over 60 workplace safety guidelines to help businesses protect their employees and customers. To date, we've allowed the reopening of select businesses that could operate safely. We're in constant discussions with our Chief Medical Officer of Health and the command table and health experts. We're taking the time to get it right. And today, following consultation with my cabinet, our health officials, and key stakeholders, I'm prepared to announce that as of Friday, May the 8th, at 12:01 a.m., garden centers and nurseries will be allowed to open. So heading into Mother's Day this weekend, please be sure to support your local garden center and nursery and pick up some nice flowers for all the great moms out there. Furthermore, as of Saturday, May the 9th, at 12:01 a.m., hardware stores, safety supply stores will be allowed to reopen. This means people will be able to shop in stores as long as these businesses follow strict public health measures to protect staff and customers. The same workplace safety requirements that apply to grocery stores and pharmacies will apply to these stores. Those include physical distancing, contactless payment options, and sanitizing surfaces. They can also continue to offer curbside pickup and delivery. We're also expanding essential construction to include demolition work related to essential construction projects and multi-unit residential projects such as condos and apartments. For these buildings, below-grade work will be permitted, and existing above-grade projects can continue. So we can keep adding more housing and creating more jobs on the path to economic recovery. For non-essential retail businesses, we also have some good news today. As of Monday, May the 11th at 12:01 a.m., retail stores with a street entrance will be allowed to provide curbside pickup. They will have to respect public health measures and the same workplace safety guidelines as well. We'll continue working to get more businesses and services online as safely as we can. I want to be clear, all public health measures remain in place and will be strictly enforced. We can't take the progress we've made for granted. And we have seen in other jurisdictions that moving too fast, ignoring the advice given this virus, and even giving it an inch can set us back. So we will move forward, but we will move cautiously. We will move with cautious optimism. And together, we will get through this. My friends, we are at the start of a long road and a long journey of recovery. The hard work of rebuilding what we have lost is still ahead of us. But we will be there for you. We will be there for each other. And together, we will get the job done. Thank you, and God bless the people of Ontario. Now, I'll hand it over to Minister Fedeli.
Thank you, Premier, and good afternoon. Last month, our government announced $50 million to help businesses find solutions to retool their operations and help in the fight against COVID-19. Today, we are very proud to announce that Oakville-based Virox Technologies is the first successful recipient from the Ontario Together Fund. With an investment in a high-speed manufacturing assembly line to double their production of disinfectant wipes. This is just one example of businesses stepping up through the Ontario Together web portal, and we will have more to announce in the coming weeks. We'd also like to thank those businesses that are now safely operating or preparing to open their doors soon, including Ontario's world-class manufacturing and auto sector. We know that COVID-19 and the difficult but necessary steps we have taken to protect public health have taken a toll on businesses across the province. And we know that Ontarians want to support their neighbours during this difficult time. That's why we are making it easier to support local mom-and-pop shops by allowing retail to offer curbside pickup and delivery, and opening garden centres, nurseries, hardware stores, and safety supply stores for in-store purchasing. Easing restrictions on essential construction projects, including multi-unit residential construction projects like apartments and condominiums, while ensuring that proper guidelines as provided by the Ministry of Labour are being followed. Last week, we challenged businesses in Ontario to work with their employees and their customers and put the proper guidelines into action so we can protect health and safety as we reopen the economy. In the last few days, the people of Ontario have shown they are ready to do their part to make sure we can open safely. This is part of our stage-by-stage approach to reopening the economy. Supporting the next phases of Ontario's action plan, the new Ontario Jobs and Recovery Committee will continue our ongoing active discussions with the businesses and key sectors across the province to assess the impact of COVID-19 on the economy. Minister Phillips will now provide an update on the work that is underway to plan for the recovery. Thank you.
Thank you very much, Minister Fedeli. Today we see more light at the end of the tunnel. We are getting ready to reopen the province when it's safe to do so, guided by the best health and science advice. I want every person in Ontario to know we'll support employees and employers every step of the way. This is one of the top concerns that we hear from the business community, and it's a focus of the Jobs and Recovery Committee. Last night, I participated in a Durham Small Business Roundtable hosted by Ministers Sarkaria and McNaughton. The small business owners and representatives of boards of trade had very practical questions, looking for guidance on how to open and how to keep their employees and customers safe. It's top of mind for them, and it's top of mind for us. We are providing clear workplace safety guidance so businesses know what they need to do. As the Premier mentioned, more than 60 guidance documents have been released, and they can be accessed at covid19.ontario.ca. Our advice comes from the real world. We're learning from the experience of essential businesses in our provinces that have remained open during the pandemic, and I'm grateful that businesses and organizations have responded to our request to share lessons learned, including emergency childcare operators and retailers. It also includes the government's own retail operations. Back in March, I spoke to George Solis, the LCBO's CEO, and we asked him to monitor closely what was working and what wasn't so that we could take those lessons for our broader reopening strategy. Keep in mind the LCBO has large and small retail facilities in urban and rural areas of the province, as well as extensive e-commerce, logistics, and warehouse operations. Among other things, they've implemented extensive new cleaning procedures, provided their staff with personal protective equipment, and studied flows of traffic within their store to encourage physical distancing. Now, as we'd expect, there's always robust conversations about the specifics, but the LCBO and the union that represents their employees, OPSU, have collaborated effectively on shared goal of protecting staff and customers. The learnings that we're gathering will help other businesses as we build on our Team Ontario approach in the reopen phase. Our approach to reopening will be methodical, so that all of the efforts will not go to waste. We must continue to work together, and we must continue to be open to learning. By being patient, diligent, and determined, we'll get through this together. Thank you.
We'll go to the phone line for questions. Just a reminder, one question, one follow-up. First question.
First question comes from Christina Tenaglia from CP24. Please go ahead.
Hi, Premier.
Hi,
I have a bit of a long start here, but this is the gist of my two questions. I want to ask you about long-term care homes in the province. The majority of long-term care homes in the province, 58% are private. I spent the last 2 days at Orchard Villa, long-term care home and retirement home in Pickering. Between the two homes, 65 people have died, the greatest number of deaths in the province, and soon there will be a 66. Patricia Crump is an 86-year-old resident. She was on that heartbreaking cover of the Toronto Sun on April the 23rd, staring out the window at her daughter, and you mentioned that day how you were touched by that photo. She is COVID-19 positive. She will die perhaps today. I have seen her. Her death is imminent. The doctor confirms this. This is a private home with a history of failing to comply with provincial rules. Her family says, end these for-profit homes. A former manager of a private home that we chatted with says, these are for profit. They're about the bottom line. So my question to you is, when do you say enough is enough? We are going to end the business of caring for this province's most vulnerable. And I'd like to point out to you as well, Elizabeth Wetlaufer, the serial killer nurse, spent most of her career in which she killed 6 people at a private for-profit home.
Well, first of all, Christina, my heart and prayers go out to the family. It's heartbreaking, and I remember that picture, and I remember that day as well. And I know the system's broken. First of all, the system is absolutely broken. We are going to fix it, but we have to make sure we take care of the crisis right now. And if you don't mind, I'm going to hand this over to the Minister of Health. Thank you.
Well, it is a heartbreaking situation, what's happened in a number of long-term care homes. The deaths are tragic, and we certainly express our condolences to the families. But we are taking action. We have asked for the assistance of the armed forces. They have come in to 5 long-term care homes to provide nursing and infection control protocols. We also have hospitals that have come forward, willingly have come forward to send in their staff to make sure that the staff levels are up, that there are people there to help with nursing, with cleaning, with infection control, feeding the residents. There's a lot of work that we need to continue to do. And as such time as the armed forces need to leave, we are going to continue to work with our hospitals to make sure that we can go into the long-term care homes to stabilize them, to bring back the staff that have left, to make sure that they come back, to make sure that they're properly staffed on an ongoing basis. But of course, there will be questions that will remain afterwards that we will have to deal with. But right now, it's very important that we deal with caring for the essential needs of this very vulnerable population in our long-term care homes.
Thank you, Minister. Thank you, Minister. Premier, what I'm wondering is, as the Minister noted, and you said the system is broken, we do have to fix it. I'm wondering about the aftermath of all this. I mean, do you support, in some capacity, ending the privatization, like it's a business of caring for vulnerable people? Do you support the end of that?
Well, Christine, as I've mentioned before, when we look at this, we are going to need federal support. And we aren't in the financial spot to be able to fund the whole system, but I'd love to sit down, and I've mentioned this to the Prime Minister and Deputy Prime Minister. We need their support. They've done a great job supporting us in so many other areas, and we're very grateful for this. But this is what keeps me up at night, Christina, these long-term care homes. And every single morning, first call is the status of long-term care. And I'm on the phone constantly with our health table. I mean, constantly trying to make sure that we fix the system. And we're making a little headway, but I'm the first to admit the system's broken. This ship had cracks in it when we inherited it, and it's been going on for decades. It's not about one government, by the way, either. I'm not going to point the fingers at the previous government or the government before that. The system is broken. We are going to fix it.
Next question.
Next question comes from Mark Douglas from 680 News. Please go ahead.
Thank you. Question for Premier Ford. We heard some great news this afternoon for the retail sectors that were mentioned in terms of their reopening dates. I'm wondering when restaurants might be able to expect the same kind of good news for when they'll be able to allow patrons to come back and have a meal in the restaurants.
Yeah, Mark, so many restaurants, and we all know restaurant owners, right? Pretty well everyone knows a restaurant owner, and it's tough right now for them. They're holding on by their fingernails. I just want to tell them, just hang in there. We're going to be there to support you. We've put other supports in place, and hopefully sooner than later. I can't give you a definitive date, but I have an idea. Why don't I pass this over to the Minister of Economic Development that's putting these lists together. But as quickly as these numbers come down, we're going to be able to open up and practice social distancing. And I've talked to a lot of restaurant owners. They already have their plans in place when that day comes, and hopefully it's going to come sooner than later.
Thank you, Premier. Mark, we take our advice from the Chief Medical Officer of Health, our Ministry of Health, and our Ministry of Labour. What we can say to the restaurant groups right across Ontario is go to this website and begin to prepare. It's ontario.ca coronavirus, and you will see about the third link down, you will see from the Ministry of Labour the requirements. This is a sector-by-sector set of guidelines. So start by going there and understanding what your business will need to do to help with social distancing, and be prepared. Thank you.
And a follow-up for either Minister Phillips or Minister Fedeli, whichever of you feels may be best qualified. The extension of the emergency orders will keep most of the doors closed beyond Victoria Day long weekend now, with the exceptions of the retail stores that were mentioned this afternoon. Has the provincial government run the numbers on the economic impact to the Ontario economy by keeping the bulk of the emergency orders in place across the long weekend? And what is that? What are those numbers? What is the financial impact forecast to be?
What I'll do to answer your question, all three of them are highly qualified, but I'll hand it over to the Minister of Finance on that question.
Thank you, Premier. So we will continue to take the best health advice with regards to timing, and as we talked about in our framework earlier, we'll move forward in a systematic fashion to make sure that openings happen in a safe way. This isn't just to open the businesses, but it's because the businesses have to have customers. And the people of Ontario need to have the confidence that we're doing this in such a way that they can feel safe. And that's why we'll be led by the health and science advice. In terms of the impacts of the economy on the economy, obviously there are significant impacts. It's one of the reasons why, unlike other governments in Canada, we did a reforecasting and looked at what some of those implications could be. You can be assured that we review those on a regular basis and look as well to the private sector and their understanding of the impacts. We will, by August, as I always have, provide a full update every quarter so that we update on the specific economic impacts. But again, I would echo what Minister Fedeli said. I think the important message to businesses is to look to the guidelines that are available on the website he talked about. Look to getting prepared. There was some good news, I have to say, in the last short while for restaurants. As you know, one of the things that we did as a government was change the regulations so that they could deliver beer and wine and liquor with their orders. We made an amendment to a regulation to make that easier. So we'll continue to do those things that we can do to allow their businesses in that takeout and pickup fashion to be successful. But we'll move forward in that phased process. And again, they should look to the rules and get prepared. We certainly want to get the economy open as soon as we can, but only when we can do it safely.
Next question.
Next question comes from Travis Danraj from Global News. Please go ahead.
Hi there, Premier. Question for you today. And I think the last few months have given us all a lot of perspective. And with that in mind, I'm just wondering about the announcement, the press release that came out from your office about these license plates and that you're not going forward with the design. Was this battle over license plates worth it with this perspective? And also, was it worth the taxpayer dollars that were spent?
Well, look, these plates really, honestly, Travis, have not been top of mind for me over the last little while. What I can say is we got feedback from our stakeholders, and we're following their advice. We'll not be moving forward with the new plates for passenger vehicle use, and further work is needed if we were to move forward with the new plates. And right now, Travis, I'm just not ready to put any more resources towards this. And we'll run through all the inventory of existing plates we have, and also look at ways to use the new plates for non-passenger vehicles. We have over 31 other categories of vehicles we can use the licenses on. And I just want to mention about the money there. There's no additional cost to the taxpayers on this.
Follow up?
My next question is for you as well. QP put out a release today saying 2,892 healthcare workers have been infected with COVID-19. That's 15.8% of the province's COVID cases, and they say 5 have died. They're saying that these long-promised masks, N95 masks and other PPE, have not arrived. Supplies are low in hospitals and long-term care settings. Why are these workers still fighting for the PPP that they need months after your government said that they were going to have everything that they need?
Well, every single hospital and every single long-term care has PPE. All they have to do is call. The hospitals go through another avenue, but long-term care, I think I've stood up here almost every single day. We have PPE. When I was informed the other day about the gowns, I came right out and told the people, we're falling short on gowns, but we still have them. But that's one of the areas that we're focusing on, domestic supply. But any long-term care facility that does not have PPE, just call. Just absolutely call. And I'm up here every day saying the same thing. We have PPE that we can ship within 24 hours in probably vast majority of the cases, at the latest 48 hours. But again, I think we've sent probably a half a dozen letters to long-term care homes. I guess we'll send out another one saying the same thing. Phone and keep track of your PPE, and we'll have it there in 24 hours because we have it.
Next question.
Next question comes from Natasha McDonald from Radio Canada. Please go ahead.
Hi, Premier.
Hi, Natasha.
Ontario missed its testing target for a second day in a row with 12,000 tests yesterday. Yesterday, you blamed medical officers of health. Many reacted by saying testing is a provincial responsibility. So what's your response to that, and are you blaming local health leaders for a problem that your government should be fixing?
Well, let's be very clear. I don't want to blame anyone. And Tasha, people expect me to push the system. The people of Ontario expect me to push the system. And it's never personal, never ever personal. Because I think public health is doing a fine job. But when I see a graph and, you see 70% roughly doing 100% of the testing, or 80% of the testing, something's wrong. And if I sit back and I don't push these regions, who else is going to push them? And to be very fair, we had an in-depth conversation last night and this morning with our health team and our Ministry of Health, and that we're working hand in hand. We just want to work with them. They do have a responsibility to coordinate testing, and maybe we'll make it very clear when the province puts down a provincial order to get everyone tested. We mean it. Get everyone tested in long-term care, and then go to retirement, test all the healthcare workers at long-term care. I don't know how much clearer we could be, but it's not about going after someone personally, and if they take it personal, then I apologize, but let me tell you, everyone has to be held accountable. I'm accountable for this whole province, and I'm going to push the system, and we'll continue to push the system until we get the numbers.
Follow up?
Premier Legault eased some restrictions on long-term care homes yesterday where there are no outbreaks. He's allowing for caregiver visits and walks. Premier, many seniors are depressed, they're isolated, and that has negative health impacts. So should Ontario follow Quebec and allow families to be with and care for their loved ones?
Well, I respect Francois Legault's decision, or Premier Legault, I should say, but we aren't ready yet. That's how the spread started. The seniors And the elderly folks in the long-term care, they didn't have it. It's people coming in, visitors, and also some of the health workers going from place to place. I can't allow that right now. It'd be massive risk to the whole system again. And we'll get to that point, but I just want to make sure we get the green light from the Chief Medical Officer. But I truly believe we're nowhere close right now to that point.
Next question.
Next question comes from Victoria Gibson from iPolitics. Please go ahead.
Hi, Premier.
Hi.
Earlier this week, Toronto's Associate Medical Officer of Health asked your government to consider the guidance issued in British Columbia around providing prescription alternatives to street drugs and whether it could be adapted for use in Ontario, given the hundreds of suspected overdoses in the city through this pandemic and dozens of people who have died. Your office says this isn't something currently being considered. Can you explain your thinking on that?
Sure, I'll pass that over to the Minister of Health. Thank you.
Well, different provinces choose different paths, and that is not something that we are considering in Ontario right now. It may well work for BC, but we have our own mental health and addictions plan that we are offering services online to people. That is for both mental health issues as well as addiction issues. That shows very promising action. We have a number of lines that are available to people with different issues and at different ages. That is Ontario's choice, and that's the course that we are going to continue to follow.
Follow-up?
Yeah, to follow up, the medical officer of health for one of Ontario's local health units in Kingston, Frontenac, Lennox, and Addington has asked, along with their mayor, for your government to give them more autonomy around lifting restrictions heading forward, pitching a more regionalized approach. Do you envision this happening, or do you think the return to normal will be largely dictated from the provincial level?
Well, you know, we have to run the province as one group, one unit. That's how we've ended up getting the numbers down a bit. So, you know, we can't have people going rogue per se and you know, loosening up restrictions in one area. If they loosen up restrictions in one area, well, guess where all the people from Toronto and the GTA are going if they want to go have dinner or whatever? They're all going to flock to Kingston. And I don't think that'd be very fair for that jurisdiction. To have everyone coming in in one shot like that. So we just have to stick together. We've done such a great job. Everyone in the province, the 14.5 million people, the businesses, you know, the health teams, the health workers, everyone has stuck together. So the answer is no. We have to stick together, and together we'll get through it.
Next question.
Next question comes from Haley Cooper from Newspack 1010. Please go ahead.
Hi, Premier.
Hi, Haley.
I wanted to ask again about commercial tenants and the province freezing evictions for tenants, because we're hearing more and more about landlords refusing to participate in the rent relief program since you and I spoke about this last week. So if the province really has no intention of freezing evictions similar to residential tenants, can you or Minister Phillips please explain why without referencing the rent relief program? Because as I just mentioned, that program isn't really going to do a lot for these commercial tenants who landlords are refusing to participate.
Well, Minister Phillips put the program together, so he'll speak on that. Thank you.
So Haley, I'd have to disagree. The program hasn't actually been started yet. It, as the federal government has said, is going to be available starting next week. So I think we have to at least wait for that program to be initiated before we judge its relative success. Obviously, we are pleased to see that the federal government has expanded the program in consultation to include the gross rent, so that now was one of the concerns of landlords. Also to make sure that landlords that did not have mortgages would be available. So that's another modification of the program. But I'll point out to you that, and these were just out of the federal government press conference this morning, people were concerned about the loans program. Over 500,000 businesses have now successfully applied for the federal government loans program. People were concerned about the payroll support program. There's 110,000 businesses that have now, as of the numbers given out this morning by the President of the Treasury Board in Ottawa, being part of that program. So I think it would be fair to say that we should wait until the program is launched, which will be next week, to judge its success. And obviously we continue and and I spoke, as I mentioned before, to Dan Kelly from the CFIB on the weekend. We continue to speak with those who are most directly connected. I mentioned I was on a town hall session with many landlords last night and many more tenants in the Durham area. So as we hear those concerns, we make sure the program addresses it, and we're hopeful that the program will work. And again, the federal government has said it'll be available starting next week.
Okay, my follow-up is for the Premier, and I agree with Travis that these past few weeks, or past months rather, have given perspective, but we do just want some clarification on this announcement regarding the license plates. So will the blue license plates, the ones that still haven't been put into the system, they'll still be sent out? And also, have the white ones been being produced, and why can't the province put the new slogan on the white license plates?
Well, Haley, you know something, again, it hasn't been top of mind for me at all in this situation that we're going through, but again, we got the feedback from the stakeholders, and they're saying that it's not 100%. So I'm not putting any more resources towards this. It's not going to cost the taxpayers anything, and we're just going to move forward. And the existing plates that we have in stock, we have 31 other vehicles that we can put them on.
Last question.
Last question comes from Cynthia Mulligan from City TV. Please go ahead.
Hi, Premier.
Cynthia.
This is a pretty big announcement today that all retail stores with a street entrance can open as of Monday.
Yes.
It raises some particular challenges for Toronto, though, where the most COVID-19 cases have been found. It's still struggling to keep those numbers under control. And I remember at the start of all this, when COVID was first coming to Toronto, that massive lineup outside a gaming store with a huge crowd. Are you concerned that Toronto's not going to be able to control the streets where there is a lot of shopping, Yonge Street, Queen Street, Bloor, etc.? I mean, it would be far more easier for more rural communities to do this than Toronto. Is this a concern for you, Premier?
Well, I had a good conversation with Mayor Tory last night. I just want to give a shout out to Mayor Tory. He's been an incredible partner, very collaborative and very cooperative. So I want to thank Mayor Tory for all the cooperation. We had this conversation last night. And as I said, there's a tale of two cities within Toronto. It's almost like the province. There's the downtown, Dundas Square and Queen Street, may be a lot busier. But if you go to Etobicoke, where I live, or Scarborough or North York, you aren't going to have these big lineups. Matter of fact, the retailers would wish there was 4 or 5 people waiting in line to get into their stores. But I fully understand downtown's a whole different kettle of fish. And Mayor Tory is going to be putting in the proper protocols and make sure that number one is the health and well-being of the citizens of Toronto are taken care of. And he's done an incredible job being a true leader in that arena.
Premier, do you think maybe in Toronto there should be some added security measures for people? For example, should Torontonians in the downtown core anyway be wearing masks?
I'm going to leave that up to Mayor Tory to put those protocols in place, and I fully understand why you're saying that, Cynthia. You look, I think it was Austria. I'm pretty sure it was Austria. There's a story on Austria that said, you know, they were able to reduce the cases by over 90% by everyone wearing masks. And when I talked to a doctor on the health table, I said, well, you know, not everyone's going to be able to get PPE. It's challenging getting it for the government. He said even a scarf would be better than nothing at all. So the recommendation to be safe, if you wear a scarf or try to get PPE, surgical mask, then I'd advise doing that, especially in a crowded area like downtown Toronto or Dundas Square.
Thank you, everyone.
Thank you, everyone. Have a good day.